As the COVID-19 count continues to soar across the globe, scientists are rushing to develop a vaccine.
Things were bleak in June last year. There were some hopeful signs that a vaccine might emerge, but no certainties. Then, a flurry of candidates appeared, including ones using a new mRNA technology from companies including Pfizer.
Pfizer wrote formally at the end of June to government, and then there were a couple of emails to and fro, and then the meeting was on the 10th of July.
What exactly happened at that meeting is contested, but whatever it was, there was no deal with Pfizer for another 4 months.
We're making sure that should these approvals be given, that we'll be able to move.
Australia made an initial purchase of 10 million Pfizer doses along with 40 million Novavax, but less than a week later it was becoming clear that Pfizer's vaccine was very good indeed.
Drug giant Pfizer has released early results, no serious side effects so far, and a 90% effectiveness.
With Pfizer in hot demand worldwide, Australia bought 10 million more in February this year and 20 more in April, bringing the total to 40 million doses, but nowhere near enough to vaccinate the whole population. With problems emerging with AstraZeneca and the Delta variant spreading, there has been growing concern about Australia's lack of vaccines.
The key is it's not a race, right? It's not a competition.
It's now emerged that senior Australian business figures in the US were so concerned they approached Pfizer's global office, seeing if they could speed things up. They were told, in the absence of a direct intervention from Prime Minister Scott Morrison, another prominent Australian, former PM Kevin Rudd, might be able to get time with the company's chairman, Charles Borla. Rudd subsequently wrote to Prime Minister Morrison on June 30, saying that in response to my representations, Dr Borla said he would personally look at what further might be able to be done. Dr Borla indicated that if it became physically possible to bring forward delivery, he would require a further formal contractual request from the Australian government to that effect. The government downplayed the intervention today.
I had a little chuckle when I saw the story. We received the letter from the individual in question. We welcome and thank them. But did it make a difference? No.
Pfizer released a statement this afternoon saying that no third parties had been involved in the contractual agreements, which was never suggested in the article or by Mr Rudd. Mr Hunt declined to be interviewed by this program tonight. Mr Rudd's intervention, however, does raise questions for the government. Why hadn't the Prime Minister engaged with Pfizer's global operation when other world leaders were doing so? This compares with the 55 phone calls to world leaders he made on behalf of Matthias Cormann's bid for the job of OECD Secretary-General. If, as Mr Hunt suggests, the deal to bring forward Pfizer's vaccines was done before Mr Rudd's intervention on June 30, why was it only announced last Friday? Dr John LaMattina is a former Pfizer Global Research President and now Senior Partner at biotech company PureTech Health. Dr LaMattina, thanks for joining us. For outsiders, it's very hard to understand this world of global negotiations on drugs and how it works. Can you give us some idea of how countries go about negotiating vaccines like the Pfizer vaccine?
Well, this was a totally unprecedented event, really, with a worldwide pandemic. And so I think things happened a little bit differently. This really about a year ago kicked off heavily when the United States decided to order 800 million doses of vaccine, COVID-19 vaccines from 6 different companies, 300 million from AstraZeneca and then 100 million each from Pfizer, Moderna, J&J, et cetera. Now, these vaccines weren't in hand yet. They were still in development, but I think countries decided to, once something might get approved, that they wanted to be able to get a vaccine to their people as soon as possible. And so, and this was particularly interesting with the Pfizer Moderna vaccines, which are totally unprecedented. mRNA vaccines had never been done before. These are being used. And even in the United States, Dr. Anthony Fauci, who's our leading medical expert in this area, was just hopeful that they'd be 65 or 70% effective. And obviously, once the data were in, they were clearly much better at 95%. But in July of 2020, none of this was really known. People were basically lining up, placing broad bets among a variety of different potential vaccines with the hope that if any of them worked, they'd have access to them.
So Australia had the choice of lining up with everybody else and taking a punt on these new vaccines, but we didn't do that.
Yeah, my understanding is that Pfizer approached, and maybe other companies did too, but Pfizer approached Australia, and at the time, Australia took a pass on ordering any vaccines. At least that's my understanding. I'm not so sure that was a terrible idea. I believe that in June of 2020, things were pretty calm, COVID pandemic-wise. And so the thought that they had to go with Pfizer or anybody at that stage might have been a little bit too soon for the Australian government. And taking a watchful attitude was probably an okay thing to do. I'm not sure I would have done that, but I'm not so sure that was a terrible mistake. However, once November rolled around and Pfizer and Moderna revealed the extraordinary efficacy of their vaccines, I would have thought that Australia, like many other countries, would have gone right away back to Pfizer and say, okay, we're interested now, assuming the FDA approves your vaccine and shows it's and demonstrates safety and efficacy, we want enough vaccine to really inoculate 80-90% of people in Australia over the age of 18. So I think my personal view is that's where the wheels fell off a little bit.
Well, our government has argued that there are only 10 million doses available, but a lot of countries got a lot more than that.
Well, let me give you a couple of examples. So the obvious one is the United States. The United States initially ordered 100 million. Once the activity was set, I believe they ordered at least another 100 million, if not 200 million more doses from Pfizer. I think they also did the same thing with Moderna. But Israel ordered enough for their entire population back in November. And at this stage, I believe they've dosed 11 million people with at least one dose of the vaccine. And I think 60% of Israel is already completely vaccinated. And furthermore, they have another order in for potential booster doses and for doses for children.
It's been reported fairly widely that the Israeli Prime Minister Netanyahu actually personally rang and ran the negotiations with Pfizer and a lot of the other companies involved in selling vaccines. How important is that sort of intervention at a really high level for a company like Pfizer?
If you want to get the intention of a company CEO, boy, if the prime minister calls, I mean, that call gets answered right away. So I don't think that's such a bad thing. In fact, obviously it helped there. I think the other thing that Israel did, to be fair, is that they agreed to share all their data. They've got an excellent healthcare network, and they were getting real-time data back from Pfizer on how people who were getting vaccinated in Israel were doing. But I think Israel got pretty creative, both with Netanyahu making the calls, as well as offering those kind of incentives for companies to say, boy, it would be great if we go there. But when I heard that, the initial procurement was for 10 million doses, I was sort of surprised, considering the population. At least the people who are eligible for the vaccine had to be about 80% of the population. So you would probably need about 40 million doses to get 80% of people inoculated. So I think that probably was not enough.
I saw that you had described the fact that we had only gone for 10 million doses as an unconscionable decision.
Well, if I was in Australia and I was seeing the rest of the world getting all these vaccine doses, and my country was late to the party, I'd be a little disappointed, to say the least. And it wasn't as if they were blindsided. So Pfizer came in June or July of last year and offered different things, and they were said, they were rebuffed basically. So I would think in a global pandemic, and I'm not a politician, I'm not a government official, but I would think that you keep a watchful eye on whatever's happening and be prepared to make a quick move if something were to change your thinking, be it a new vaccine or the extraordinary potency of the mRNA vaccines, et cetera. So I think that's sort of the responsibility of government officials.
Dr John LaMattina, thanks so much for talking to us tonight.
My pleasure.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.